Infantile colic is defined as episodes of crying for more than 3 hours per day, at least 3 days per week, for more than 3 weeks. In otherwise healthy child, it is called Wessel's rule of threes. Colicky crying is often described as paroxysmal and may be characterized by facial grimacing, leg flexion, and passing flatus. The cause of colic is unknown. Some believe it is due to gastrointestinal discomfort like intestinal cramping. Fewer than 5% of infants with excess crying have an underlying organic disease. Cumulative incidence rate of colic vary from 5% to 19% in different studies. Girls and boys are affected equally. It is most common at 6 weeks of age and typically goes away by 6 months of age. It rarely lasts up to 1 year of age. Treatment. No medications have been found to be both safe and effective. The management of colic begins with education and demystification. When the family and the pediatrician are reassured that the infant is healthy without infection, trauma or underlying disease, education about the normal pattern of infant crying is appropriate. Techniques for calming infants include soothing vocalization or singing, swaddling, slow rhythmic rocking, walking, white noise, or gentle vibration. For example, ride in a car. Eastern Europe often use chamomile, fennel, vervain, licorice, and balm mint teas. These teas have not been studied scientifically as remedies for colic. In most circumstances, dietary changes are not effective in reducing colic. Prevention. Prospective parents often imagine that their infant will cry only briefly for hunger. Increased contact and caring of the infant in the weeks before the onset colic may decrease the duration of crying episodes. Similarly, other soothing strategies may be more effective if the infant has experienced them before the onset of excessive crying. Infants who have been tightly swaddled for sleep and rest during the first week of life often calm swaddling during a crying episode. This is not true for infants who have not experienced swaddling before a crying episode. Parents also can be coached to learn to read their infants' cues of hunger, discomfort, boredom, or overstimulation. It is important to understand that there are times when the infant's cry is not interpretable, and caregivers can do only their best